right, we're going to talk a little bit about TMJ. You or someone you know may have been diagnosed with TMJ and experiencing a lot of discomfort, right? You might have jaw locking, some headaches, just really frustrating. And today we're going to sit down and talk about some treatments for TMJ. We're here with Dr. Luke. Hi, Dr. Luke.
Hi.
Dr. Luke is with Better Sleep Mid-Ohio Valley. And Dr. Luke, what can you tell us about TMJ?
Yeah, so TMJ is actually the name of our jaw joint. It's the temporomandibular joint.
Okay.
So it's kind of like saying elbow. We all have elbows, we all have TMJ. And when something goes wrong with that joint or in that area, it's often referred to as TMJ or in the medical field as TMD, which is temporomandibular dysfunction.
Okay.
And so what we provide is treatment for a number of issues that can arise in that area that could cause pain, popping, clicking, locking of the jaw, or decreased range of motion. You know, you have to squash your Subway sandwich to take a bite. Nobody likes that.
No.
Yeah.
So I know you do a lot of sleep apnea treatments at Better Sleep.
We do.
Is there a connection between sleep apnea and TMJ?
There can be. They're often correlated. So TMJ issues generally arise from a number of different sources. You might have had an injury that resulted in injury to the jaw joint. You know, maybe you took a baseball to the face as a kid, or you were in a car accident. Those can cause problems. You may have an underlying connective tissue disorder that's affecting your joints.
Okay.
Or you may be suffering from like a repetitive strain injury. So with sleep apnea, a common symptom that people may or may not be aware of is clenching and grinding your teeth. And clenching and grinding your teeth not only wears away at your teeth, but it puts a lot of strain on your chewing muscles. And it puts a lot of strain on your jaw joint as well. Okay. It's kind of surprising, but your average person can generate about 250 pounds of force when they clench their teeth. And
wow.
You can imagine that your jaw joint and your muscles are not built to withstand that kind of strain over a long period of time.
Wow, sure.
You know, if you were picking up a 250 pound weight and trying to walk around with it for a long period of time, you probably would feel some discomfort or pain in your elbows and your shoulders, your knees.
Right.
And it's no different for our jaw joint than it is these other joints. And so we often see people that maybe have been diagnosed with sleep apnea, and they also are having TMJ problems because it's a byproduct of their sleep apnea.
I see.
If you're not getting enough oxygen at night, you're in a stressed state, so you might be clenching and grinding.
Okay.
And if you and then we also see people that come in for TMJ problems that, as we're talking with them, say, yeah, you know, doc, I do snore. My wife was waking me up the other night because I quit breathing. And so we start to connect the dots there and say, okay, we've got some pain issues here, but it sounds like we also have some breathing issues. So that can be a connection.
Okay.
Not always, but it's more common than most people realize.
I see. Okay. So what would be the solution here?
So yeah, with TMJ or TMD, there can be a number of different things that are the source of pain. And so really, to begin with, we need to sort out where is the pain coming from for a given patient, or is if they're locking, where is their jaw hanging up?
Okay.
And so our first visit with a patient that's seeking treatment for TMJ is to just A, understand their symptoms, and B, put on our detective hats and then look through all of the different causes that can be happening. There's a number of different ways we do that. In some cases, we might need an MRI of the jaw joint so we can really see what's going on there. In other cases, we're able to do just some testing right there in the dental chair with the patient and get a pretty good idea of what's going on in the joint. It really varies from person to person. And it can be frustrating for people that have dealt with these issues, Jenny, because the truth is, physicians in medical school, they don't get a lot of training on TMJ. General dentists don't either. And so for a medical professional to get good knowledge of TMJ, they really have to go looking for that knowledge and get that training once they're done with school. Wow. And so I've gone through hundreds of hours of training to reach an understanding of these conditions and how they're best treated. But yeah, and depending on what the source of somebody's pain or problem is, we can guide them down different treatment paths.
Okay.
So that could look anything like a nighttime splint that they wear on their teeth, or maybe even a daytime splint, or a combination of those two that they wear for a while.
Okay.
There are different injections that we can do that can really bring a lot of relief for these conditions, and sometimes pretty quickly.
Wow. Okay.
And then
My questions. Yeah. So pretty quickly you can experience.
relief can be pretty quick once we diagnose a problem for someone.
That's great.
We've had people come in excruciating pain and leave with a smile on their face.
Wow.
And I get a hug as a dentist a lot of times, and dentists don't get that many hugs. So it's something that I enjoy. And something that's really exciting about the field of treating TMJ is there are even things that we can do these days. Let's say somebody's had some degenerative issues in their joint.
Okay.
Like kind of like arthritis, or maybe there's repetitive strain injury to that joint. There are things that we can do to help regenerate tissues in the joint, just using your own body's healing factors that can really be life-changing. It's a good time to be a medical professional.
That's amazing. Thank you so much, Dr. Luke. There are so many people that are affected by TMJ, so it's wonderful to know there are options for them out there. Thank you.
Thank you.
If you have questions about sleep or are looking for a solution for your sleep apnea, we would love to help. Give our office a call at 740-205-6103.